Good morning. It is Thursday, December 16th. Welcome into the Morning Medical Update. Thank you for joining us right here on Facebook and our YouTube channel. Today, we have seen the impact COVID is having on our daily lives. But what about kids and teens? Their lives changed drastically, just like the rest of us. Today, we are going to hear about those changes directly from a group of high school students who happen to be interested in careers in science and medicine. Their teachers recently gave them an assignment, and this is this one will open your eyes. So make sure to get your questions sent into us on YouTube. And you're right there on the Medical News Network. You can find links to those right here on your screen. Our Chief Medical Officer, Dr. Steve Stites, is also here with us to answer those questions. Good morning to you.
Good morning, ma'am. How are you?
Sir, I'm very good. Thank you very much.
Good.
Dr. Hawkinson is going to join us here in just a moment, but you have some numbers for us.
Yeah, it's and Hawkeye will have them, but I got them right here. We have 45 active infections. That's up. We are on a steep climb now. Total number of 71, 12 ICU patients, 7 ventilators. 4 of those patients are fully vaccinated. So things have climbed up a little bit. We're a little nervous about that. We know they're climbing up through the city, Jess, and I think when you walk outside or you go into a restaurant or you go into a shopping, you know why. There's no masking. It's like there's no infection out there. And just to say, we know there's a lot of influenza right now, a lot of para-influenza, which is a different virus, a lot of rhinovirus, which causes a lot of the common colds, a lot of regular coronavirus, and a whole lot of COVID going on. And now we have Omicron in Kansas and Missouri. So we also know that we talked yesterday about this, that 13% of the cases in New York and New Jersey are now Omicron. The numbers are rising rapidly. So I think it's a big deal. A couple of big pieces of news coming out, though. There always is in this cycle.
You got it for us.
One thing, Dr. Fauci is pointing out that you probably don't need to pivot what's in the vaccine as long as you get your booster. So the really important note to everyone out there, make sure you get your booster because it does make a difference. It really helps us around Omicron. The other big news that is coming out, that AstraZeneca drug, which is an antibody drug given prophylactically for COVID. Now think about that. So far we've used monoclonal antibody therapy if you get sick. Now what we're saying is you go to your physician's office if you're really immunocompromised, like an organ transplant patient or someone who's had a bone marrow transplant, or if you're in chemotherapy. You get an injection, one in each arm, it's an IM injection, and it's an antibody against coronavirus and against COVID, and this antibody lasts for 6 months in your system. And therefore, even if you don't have even if you're one of those transplant patients who don't ever respond to vaccination, you can get protection from the AstraZeneca IM drug. That's a really big deal. You get it in your doctor's office. We have to get it distributed. It's just gotten its early use authorization, so we're pretty excited about that. We're still pretty excited about Paxlovid. I think that looks like a really good step forward. So there's hope on the horizon, but infection control is what we need right now, Hawk. That is just so important. Of all the things we could talk about, it still comes back to masking, socially distancing, getting your vaccination, including your booster.
Yeah, absolutely. We know the things that protect us, and now, we had been saying it certainly that we anticipated and believed that the vaccines would still confer immunity even to Omicron. We know some of those properties of the virus haven't changed. Dr. Fauci, I think, kind of reiterated that yesterday when he talked about that specifically, just as you mentioned. And we do understand that there are, government level or leadership level decisions that are made to not do masking or not worry about distancing or those non-pharmaceutical interventions. I think we need to say those are decisions that are not informed by the science and the data. And that we know that individual institutions and private institutions can do the best things for their employees, for their clients, for their students. We know that masking works. We have seen it. It has been proven. We have shown it. And so those things can be instituted at those local levels and those institution levels.
Yeah, I couldn't agree more. And we stand our lane all the time, and we're not going to try and tell politicians what to do politically because they have to deal with a lot of questions we don't.
Yep.
But we can tell you medically what is the right thing to do. There is no question about it. And people still try and talk about masking doesn't work or all that. Well, come on. All you have to look at the data that you pointed out the other day, that STAR article, where they demonstrated every time we take our masks, we get a surge. And now the weather's going to finally start turning cold. Although, last night was just surreal. But weather's starting to turn cold. People are going back indoors, and they don't have masks on. They're acting like it was the day before yesterday. And I think that's going to we're going to continue to see the big surge. And as you know, Jess, we're going to talk a lot about that tomorrow.
I was just going to ask you about that. We're going to talk about it at the end of the show, but let's tell folks who are watching now what to expect tomorrow morning. We're changing things up and bringing in some special guests.
We are. Chief medical officers from every hospital are going to be here. We've invited political leaders. We've invited elected officials to be a part of this program. We need to tell the story. Your hospitals are busy. In Topeka at St. Francis, we've had to cut the elective joint surgeries by half because we don't have enough beds. I mean, we're back at the peak of the crisis again, and we've had 2 other times where it approached this severity, and this is our really 3rd big wave. Now, it's a 4th or 5th wave overall, but the ones where we were in danger, hospitals are in danger, and not just if you have COVID. The problem is that when you get to where we are today, what it means is if you have other time-sensitive diagnoses like a stroke or heart attack, or if you're a trauma patient, your care can be delayed. And delayed care can mean, much worse outcomes or death. Suddenly you're taking heart attacks back to where I was a resident, and all we could do is give people morphine and a prayer and some nitroglycerin because we didn't have any other therapy. And now when you don't get in, you can't get the heart cath, you can't get your vessels reopened, or you can't get the same thing, the stroke intervention. Your stroke goes on to be worse. We're out of capacity across our community, and what that means is, especially as employees get sick because Omicron and Delta are both here now, but especially the Delta wave continues, we're just going to be out of staff and et cetera, and so that means people are going to run out of time. And the only way for us to get our arms around this is to bend the curve. The only way to bend the curve is to follow the rules of infection control. So we're going to talk about that again to our whole community tomorrow. It's a really important program. I hope all our viewers tune in. We're trying to have some time for questions, but you're going to hear from every CMO in their city, or just about every CMO in the city, and they're all going to tell you the same story.
And that report is going to start right here at 8 o'clock tomorrow in lieu of MMU. But like Dr. Stites said, we're going to take reporter questions if we can, and we'll get to community questions. But the idea is we want people to spread the word. So if you've been trying to reach people in your community who you work with, your friends and family, and you want them to hear this message and all the same message coming from everyone, tune in tomorrow at 8. Before we get to our conversation, our students today, do we have any reporter questions on the line? Okay, don't hear anybody. All right, let's move on. We're going to get to community questions in just a few moments. Now, for most students, school isn't just about the academics. It's about social interactions and friendships and connections. Many friendships start just by sitting next to each other in class. Groups of friends eat lunch together every day. They hang in the hallways in the classrooms of their schools. Young people are exposed to a variety of different cultures and perspective and ways of living that may be different than their own. So joining us to talk today, it's about a school project that focuses on the impact of COVID and what impact it has had on our teenagers. Jonna Geist, she is a teacher of biomedical sciences at Pleasant Hill High School. And we are also joined by 3 of her senior students, Kelly Faust, Morgan Lassiter, and Isabel Bacon. Let's start with you, Jonna. Good morning to you. Thank you so much for bringing your students into the classroom early today. Tell us just first of all about your class, and then I want to hear more about this project.
Great. Good morning. Thank you for having us. Our biomedical science program here is a 4-year program. These students come in as freshmen, and in the first year they get a very broad overview of biomedical sciences, and this is their introduction to the curriculum of human biology. Then as they move through the next 3 years, it gets a little more intense. We move into interactions between human body systems. They get into medical interventions. They start looking at diagnostics, clinical care, emergency care, until they get to where these girls are as seniors, and they get a capstone assignment where they get to start exploring the careers that they're interested in and really start seeing which direction they can go in their next step in college and on to graduate school, and then finally into hopefully their healthcare career or whatever ends up being their focus.
So tell us, Jonna, what was the idea behind this project? Tell us what the project was and how it came about.
Well, the project was an opportunity. These kiddos get a lot of their information from social media. This is their main source for news and what's going on in the world around them. And they do get shamed a little bit for that because of the influence in politics and personal opinion. So the science classroom is an opportunity for them to get information that's not diluted or convoluted by those outside sources. So that's what we did. We brought in information, we did the science, we reached out to experts at University of Kansas Hospital, and we gave them basically pure information. They learned about the virus, they learned about its structure, they did the epidemiology, they talked about treatments, and basically as new information came in, it was presented to them. And then I let them decide how to process that information. I let them decide how they were going to talk about it, how they were going to inform other people about it, because that's what science is. You learn and then you share. So I let them choose if they wanted to write, if they wanted to draw, paint. Some of the students did projects. A few of them wrote news articles. But really the idea was give them an opportunity to process what has been happening to them over the last 2 years, which really they had no control over, in a way that was meaningful to them.
We're going to talk with those students here in just a moment. Dr. Seitz, your ears must perk up when you hear that students are not going and scrolling through social media and online, but they're actually following the science to learn and process this project.
Yeah, that is the best, because we know that social media probably doesn't have as much hardcore science in it, just probably, as what you read or what you learn when you actually discover and follow the principles of science, which are grounded in, the power of observation, the power of telling the truth, and trying to understand the world around you as it really is, as opposed to making it up. And I may be a little bit of a fan of science. I'll fully admit that. I'm kind of like a fan of Chiefs. I did wear my Chiefs red today. Did you notice that? Christmas red, Chiefs red.
I thought it was
Christmas
all at the
red,
same time. But I should have known better.
It's both. But the power of science to help advance humanity and the earth and the human condition is just overwhelming, and it's much better and much stronger and much truer than the power of the internet.
All right, so let's start with Kylie. Kylie, you plan to study dermatology in college. What did you think when you were given this project by Mrs. Geis? Tell us about that.
When Ms. Geis first assigned us this project, I kind of recently just went back to the first when COVID started, and I just thought of how in the dark I felt and not really knowing what to expect, especially not going into 2022 still with COVID when it started in 2020. It's just crazy to think how long we've been through it and not really your insight on anybody's experiences. So I think Ms. Geis gave us a great opportunity for each of us to share our experiences and how COVID has impacted our lives, because I think for most of us it will have such a significance throughout our lives. So
you showed your thoughts and feelings through art. Can you tell us about your piece of art that you created? And we're going to show it too.
Ms. Geis gave us a pretty free range on what we wanted to do for our project, so I chose to do something I think I would do well in, which was art. And in my piece, I decided to paint a woman with half her face with a mask on and the other half with no mask. And with the side with no mask, I wrote about what life before COVID was, and then when it first started and how it impacted me. Hence why there's no mask, because before COVID we didn't have to wear them. And then on the other side where there's a mask, it says new normal on the mask, and I think this just represents how harsh of an impact COVID has, because even the precautions we've taken for it still have a lasting impact, from wearing masks to just hygiene. And I think some of these have been good, but some of them have been harder to get used to.
I want to read what.
That's pretty cool.
I knew you were going to love that piece of art.
I did. That is pretty powerful.
The tears on the unmasked side.
Yeah, no. So is this for sale? What do we do with that?
Yeah, where are you going to put that?
Yes, about $400 for this.
There you go. There you go.
All right, Kylie, let's talk.
All right, I'm going to hook you up, Kylie. Tell me, Kylie, I want to read a quote that was on your project, on your piece of art here in just a moment. But just how has the pandemic affected you personally? What can you remember as one of the points where you thought, wow, this is different?
Well, I feel like COVID has really affected me a bit more negatively than positively. But at first, I feel like I was more relieved because it was said to be just a 2-week break. And at the time, I kind of was stressed out with school, so I thought that'd be a nice time to just relieve some stress. But that was not the case, and COVID started to prolong more into the year. And I think this made it hard for me to keep a positive outlook because it was just thing after thing was being taken away, from not being able to go to school, not being able to go to dance or trips or anything, actually. It was like the timeline for COVID just kept getting longer and longer, and I feel like for me that made it hard for me to have hope for the future. I think that hit my mental health hard too, because all I really could do was stay home with my thoughts and just feel alone because we couldn't go out with our friends. Everything was pretty much shut down, so there wasn't much to do.
Yeah, what you said, we have lived with COVID for the past 2 years now, and it has affected many aspects of life tremendously, specifically in our healthcare, economics, and socials. But we have learned to adapt and overcome the struggles in order to create a new sense of normalcy. I want to jump, Morgan, I'm going to come back to you. I want to get to Isabel, and Dr. Seitz, I'll have you kind of ask her a little bit about her project. She's going to become a radiology technician, and she's been accepted to Mizzou.
Oh, that's awesome. Let's work on this for just one thing, because Isabel, if you're going to go to Mizzou, we're going to work on this right now. And by the way, Missouri had a great signing class in college football. MIZ. Hello, MIZ. This is part of your education. MIZ. You say.
ZOU.
Okay, there we go. Thank you.
That's all right. She's going to get it. She's going to get it.
No, you're there. Now listen, I grew up a tiger. I'm now also a jayhawk. There's a very rare bird. It's called the tiger hawk, and some of us can cheer for both.
That's right.
I got mad at Mizzou when they went to the SEC. I'm still not quite over it, but I know how to do it. Say MIZZOU. It's an awesome cheer.
Okay.
And Isabel, you'll be doing that a lot next year.
Way to go. So I want to just talk to her a little bit about how the pandemic affected her. Tell us a little bit about that, Isabel, excuse me.
So a big change was like schooling. My family are both my parents are teachers, and so going from like an 8-hour workday to a 10-hour workday, and they're both coaches, so that turned into a 12-hour workday. It just I was left alone with my sister a lot. I didn't get to see my parents a lot. So I kind of tore our family a bit. We never got to see each other or have those conversations. So yeah.
I want to ask you about something. You said in your project, and I want to hear more about your project, but one of your quotes was March 16th, 2020. I was on my way to get my driver's license. My 16th birthday had been the day before. I had heard about the spread of COVID-19, but never thought it would come so quickly. I heard my mom sigh as I looked over to see the despair in her face. She had told me that the school had decided to shut down for 2 weeks due to COVID. So quite a range of emotions. You were on your way to do something really fun and exciting, a big milestone, and it got sidelined due to COVID. Just tell me a little bit about how you've adapted to some of those changes.
Honestly, I'm still adapting today. It's a lot. I'm a very I don't know, the mask helped a lot. I'm a very anxious person, so I'm still adapting to that, but that helped me. But I like being with friends and people, but with COVID, you weren't able to go out and do be with friends. Oh, and volleyball. That was a big change. We weren't able, you had to wear masks when playing, and in basketball, which was really hard to adapt to when you're not used to have a covering over your face, when you're breathing. That was hard to adapt to, but I learned eventually. So
yeah, you did it. You did it well.
Have things gotten better for your family? I mean, when you told that's heartbreaking, because people did get torn apart. It is hard. How has that gone?
Luckily, it's gotten better with this year. We went back to our normal schedule. My dad is my basketball coach, so it's better to see him while he's coaching. But my mom, I still don't get to see her a lot. But my dad teaches here, so that's better. So yeah.
Tell us a little bit more about your project. What did you learn from it? What did you get from it? How did it help you?
It helped me a lot I just was able to express myself. I feel once COVID started, we all just kind of separated, we never united and just told our stories, and I felt like I was able to finally express how I felt about it and my feelings, and I was able to get my story out there.
You also wrote, change, sometimes it can be good, other times not so much. As I wrap up this memoir, I realize how much I have changed, how much my life has changed because of this pandemic. And while it may have been hard, I am ultimately grateful for this experience and that we were able to become educated and help others so quickly.
That's awesome.
Pretty darn insightful.
That's pretty darn good, Isabel. Well done. You will make a great tiger.
Okay, let's get to Morgan. Accepted into physician's
Thank you.
assistants. Morgan was accepted into the physician's assistants program at Park University. Congratulations to you. Tell us how this pandemic has affected you.
Thank you. Personally, I haven't gotten sick, and neither has my close family members, but I know some family friends have been affected by it, and just seeing what they had to go through really took a toll on me and my family. We were seeing the effects that how everyone is truly affected differently by the virus. So just seeing that really made me more nervous for the future to see how it's going to keep progressing.
Tell us about your project.
I wrote a personal narrative. So when Miss Geis told us we could do this project, she kind of just gave us free range. We could do whatever and express it however we wanted. And my strongest subject is writing, so I thought I should write a personal narrative over it. I wrote about my thoughts, feelings, everything in it from when we first got told to now with living with COVID.
You wrote March 16th, 2020, the day the world shut down from COVID. COVID-19 has not affected my life physically, but has changed it drastically. Tell me about that.
It's just, like Isabel said, adapting to everything. You know, our town was very torn with what they wanted to do, and as students, we didn't really get to put our opinion in with how we wanted things to go. They kind of just told us what we were going to do and thrown into it. So like last year, we got put into 2 different shifts, so I didn't get to see many friends, and I had to go to school 12 to 4 o'clock every day, and then sports afterwards. So it really took a toll on my life personally. I didn't get to see my family as much, and it was just hard knowing that I kind of had to do it. I had to learn from it, do it on my own, because everyone is different when it comes to it.
You went on to say, I was not allowed to leave my house for 2 weeks. No outside contact. I could not go outside to sit on my I could only go outside to sit on my back porch, and that's it. My only source of vitamin D, my only way of knowing the world around me was still rotating. It felt as if time stopped.
That's impressive. You know,
That's
again,
ridiculous.
it's easy for us to talk about. It's so much more real when we hear from these 3 students and for voices from everyone. It's been hard. You know, we had our big physician provider meeting this morning, and we just said, I've been in medicine for 6 years. This is the hardest of times. And to these teenagers, my heart goes out to you. I love the point that you've
Yes.
learned something from this, and I think that is right. We've all learned something from it, and hopefully we can bring this thing to an end here with some new medical advances, some new therapies, and if we all keep trying to do the right thing around each other.
Dr. Hawkinson.
Yeah, you know, I was just going to say we heard that it was tough to adapt to the mask, but they adapted. Certainly what I think is tougher from what I'm hearing and what they have said is that it's more difficult to be at home isolated. And so I think it goes back to that message of it is so important to have these kids in school. We know how to keep them safe in school, keep them socializing, keep them, you know, being able to get lunches. A lot of children depend on lunches, school lunches for a meal. Just keep them learning. And so I think, you know, this kind of reiterates and reinforces what we've been saying.
We've had separation from each other. What we don't want to do is separate ourselves from hope and love, because we've said in the program before, you know, faith, hope, science, love, and that this question of being in a community is critically important to how we are as people. So we got to master this pandemic so that we're not always separated.
They're finding new ways to
we
connect.
have to connect.
So, Jonna, I want to ask you, because we talk about people being on the front lines of this pandemic, and you certainly have, as far as students go. I want to talk about that. What have you seen? I mean, as far as their resilience, but also some of the concerns you've had. You know, I'm sure you've had some conversations and you probably have good relationships, close relationships with these folks, but what have you noticed and observed?
I think the biggest thing to remember, again, is that they did not have a voice in what happened to them. They didn't get to choose whether they went to school in the morning or the afternoon. Many of these students were asked to, again, care for younger siblings. They had to grow up very fast, very quickly, and they didn't have a lot of guidance. They did a lot of learning on their own. They spent a lot of time with computer screens, and it changed them. And it changed them all in a different way. And I think it's really important as these kids go out into the world to get jobs, to interview, that the people in the industries they need them. They need these young voices and these sharp minds, but they need to understand that the soft skills that you get from working together and learning together still need a little work. And that's one of my concerns, is that these guys get a little bit of grace and understand that, again, they've been isolated and all their interactions have been digital for almost 2 years now. So take the time to give them a little extra when they're interviewing and when they're training and talking, and help them develop those skills to interact personally again. They have a long road to go in terms of catching up. They didn't even finish school 2 years ago. Last year was not... it wasn't the rigor and the level that they needed, but they still got through it, and they did persevere, and they endured. And some of them came out stronger, and some of them came out with a little bit of issues with confidence and anxiety. And I really hope that, you know, the communities embrace them and understand that they have come through a lot. And again, many of them with no voice, with no support, and not intentionally, but it was just the world we were living in. Parents still had to go to work. You know, they couldn't quit their job and stay home with their students. We had to separate the kids, so they couldn't be here all day for us to give them as much support as they needed. So just, you know, they're going to need some grace, and they're going to need some support, and they need people to come to rally behind them and help them get caught up.
Great insight, Jonna. Thank you so much. We're going to get to some community questions. We've got, as you can imagine, a bunch about COVID. But if you four will hang tight, we may have some community questions for you as well. Deb has a question. Dr. Hawkinson, how long do vaccinated people need to wait before their booster? While waiting for the booster, do they have protection against Omicron?
Yeah, certainly we believe you have protection. The best, most recent data would suggest you have protection. Dr. Fauci said yesterday, you still have protection. We don't need to pivot the current vaccines at this point in time for Omicron. I would suggest not doing it any time before that 6 months, because that time frame also, again, allows your immune system to continue to evolve and mutate, if you will, during that time while your immune system is still learning those B cells and T cells. So I would suggest not doing it any time before that recommended 6 months. You still have protection during that 6 months, especially against hospitalization and severe disease. So waiting that 6 months, I think, is really crucial.
Just get the booster.
Get the booster, no question about it. And we do know that it makes a huge difference. And so we're really recommending. There was a debate there for a while about whether or not people should get boosted. It was the right thing to do. We should get more shots around the world. And the answer is all the above, or whatever the letter is. It's all the above, that we do need to get vaccination around the world, and we need to get boosted. Also, just to say, big article in the New England Journal of Medicine posted last night about the Novavax vaccine, saying 90% effectiveness, looks just like the mRNA vaccines, and it's a piece of protein, and I think that's going to be, I bet, another fourth vaccination. And next thing we ought to just mention is that the CDC Advisory Committee is going to relook at the J&J clotting data. And so I just, there are some potentially increased reports of more clots with the J&J vaccine. So if you've had J&J and you're going to go get a booster at Hawkeye, I think I'd go for the messenger RNA boosters. Yeah,
I think those mRNA platform vaccines have really shown and proven to be very effective, very safe. And if you are concerned about other countries and you have your social conscience about not receiving the vaccines, there is a totally separate process that the federal government allocates vaccine supply to other countries. The supply that we have here is for the United States, and there's nothing that anybody can do about it. There is allocation to the states. So if those vaccines go unused, they do not get shipped to the other countries. They get wasted, and I think that's more of a terrible issue than obviously somebody with a social conscience wanting these other lower income places that don't have those vaccines to get vaccines. We certainly want that as well. The more people we vaccinate, the better off our whole world will be. But unfortunately, we have a supply here, Steve, of vaccine that is going unused. So please, if you are eligible for vaccine, go get vaccinated. If you are eligible for the booster, please go get boosted.
And if you've had the J&J, get a messenger RNA booster.
Yes.
I think that's the emerging story. Yeah. And if you haven't had a shot yet, get the mRNA. Novavax also looks pretty good, so that'll be an interesting thing to follow and see where that goes.
Isaac says he's read that the area of South Africa where Omicron started, cases may have already peaked. Vaccination rates are much lower. So is that good news for us? What could that tell us as far as where we are?
Well, I think what it means is that Omicron is so transmissible that it's going to peak in it faster. It's going to just rise faster, run through the population faster, and then start to go down. And so I think that, I don't know if that's good news or bad news. It is just news. And so we'll see. There's so much we don't know yet about South Africa. It's hard to know about, and it's hard to speculate a lot about it. Remember that South Africa had a 70% COVID positive rate, that 70% of people had already had it, and that only 30% of the country was vaccinated. And so how it behaved in South Africa may be entirely different than how it behaves in other areas. We have to watch very closely with Denmark, where vaccination rates are very similar to that in the United States, and where the what's estimated the percent positivity of COVID is very similar to the United States. So Denmark is probably going to be a better example of what we can expect to see here in the United States.
Diane well, hold on a second. Let me ask this one. So Holly says that they have a family member that is a male, 25, almost 26, is due for his booster, is concerned of heart inflammation. Are there reports of this in the boosters, and what advice could you give him and his wife? And does it have to do with being a male or female?
Get boosted, Doc.
Yeah, I think there is some demographic important information there. Certainly males, and I think, what was the age? 19 to 24
26 or 25
was the highest risk. But we also know that your risk in that age group, or males even teenage years to about 30, I think, their risk of getting the heart inflammation with COVID infection is actually like 6 to 10 times higher than if you get it with the vaccine. So overall, and we know that the disease is continuing to spread quite prevalently in the community, go get the booster. Your risk of getting the heart inflammation is much lower than if you get the actual infection.
Yeah, we know that from the Big Ten had that study looking at MRI studies and athletes who had COVID, and finding that there was a fairly significant number of athletes who had heart inflammation that otherwise wasn't detected with COVID-19. But the key is that people still get better. Vaccination, the amount of inflammation is markedly less than it is with COVID-19. So if you want to make a choice, especially with the arrival of Omicron, really getting vaccinated is far, far safer. Whereas there have been a few deaths, I think there have been 9 reported deaths now from vaccination in the U.S. with the J&J vaccine and the risk of even getting the clotting disorder is about 100,000 to 1. So it's very low odds, and the risk of dying from it is markedly lower than that. But nevertheless, those odds that's just not even, the messenger RNA vaccines are just so darn safe that even if you get a little bit of heart inflammation, you're going to do fine.
Judy wants to know, question for the docs. My daughter had the J&J vaccine and felt horrible for 24 hours. Now I'm having a hard time selling her on getting the mRNA booster because she's afraid she's going to have these bad effects again. I'm trying to convince her that it's a different vaccine.
Well, it's a different vaccine. You may still have the effect, and we're not going to minimize that. And I had the second messenger RNA vaccine, and with the Moderna, and I felt terrible, man. I was wiped out for 24 hours. But the next day I was fine. And the good news is I was protected. And I think that's the thing to sell. Those side effects, they are self-limited, and they're going to end. But they're also going to help you end COVID, Hawk.
Yeah, I completely agree. I think we know, and it's well documented, that a large proportion of people will have those transient or short-lived effects. Some people may not get any. My younger children did not get any effects whatsoever. We know it varies. It is heterogeneous. It is different between individuals and populations. Most of the symptoms are arm pain. Some people will get fevers and chills, but to your point, Steve, It's transient. It's very short-lived. You will get over it. But you can take comfort in the fact that knowing that you will have protection, and there is also data to show and suggest that you will have a reduced chance of spreading it to others, especially if those other people are vaccinated.
So important. And just to say, I had my COVID booster and I was just fine. So,
Yeah.
I was much worse after my second shot than after the booster. So maybe this person would have it. But at the end of the day,
Still got to get it.
go get it. Because if you want to stay safe and you want to keep the people around you safe.
You know what? Schedule it for your last day of work when you don't have to work for the next couple days or something like that. Schedule it for a Friday if you want. Schedule it if you want to be home watching the Chiefs or watching the bowl games so that you can stay home the next day and use that as an excuse. But just take comfort in the fact that you know that you will be protected, and you will be protecting others as well.
Okay, Isaac, curious about wastewater testing in the Kansas City area. Have they found Omicron?
You know, we looked for that yesterday. I've not seen any reports of Omicron in wastewater testing. I know there was a case of Omicron out in Kansas. There's been some in Missouri. It's coming. I mean, whether it's here now or here's what I think it's already in the community. We just haven't found it yet. But I suspect it will make its presence known over the next 1 to 2 weeks, and we'll see it in wastewater. By the way, the wastewater testing around COVID-19 still does show predominantly Delta. It's still at an incredibly high level, some of the highest levels we've seen throughout the pandemic.
Linda, curious, if a non-vaccinated person gets COVID and a vaccinated person gets COVID, is there a risk of the non-vaccinated person spreading a stronger strain than the vaccinated person?
No, the strain you spread is the same strain. Remember that the vaccinations were always meant to protect against severe illness and death. Think about influenza. You can still get influenza, but you don't die from it. You can still get polio, you just don't get the disease from it because you've had the polio vaccine. And so what the vaccinations usually have just reduced the risk of severe illness and death. With the original strain, it appeared that vaccination also helped prevent you from getting the disease, which is really remarkable. It also, remember that the vaccinated population is 6 times or 5 times less likely to get Delta than the unvaccinated population in a similar exposure. So vaccinations still protect you even against getting Delta. We don't know what's going to be true about Omicron around that yet. I suspect it will help reduce the risk of Omicron, but Omicron is incredibly transmissible. Hopefully the evidence holds out that it's less severe. But I think that vaccination in this situation, Hawkeye, I don't think it makes any difference about this. It doesn't change. It doesn't make one virus more powerful than the other. It's all the same Delta variant right now in our community by and large.
Yeah, certainly. And again, that other article I alluded to, now that was taken, probably during Alpha or early Delta, which again did show that vaccinated people did have a decreased spread of the disease. Will you create a stronger variant or strain? If you're non-immunocompromised, more than likely not, and no. If you're immune suppressed, the problem that we continue to be concerned with is that you won't really be able to control the virus very well. In that way, it can have mutations. It can have those amino acid substitutions and spike if you have a prolonged continued viral replication stage. But overall, I think, Steve, you're exactly right. The bottom line is no.
A couple more questions, and we're going to get to some final thoughts. Joanne, curious if the treatment is the same for all variants.
Yeah, absolutely. At this point in time. And again, our treatment algorithms and modalities for inpatients, for people that come to the hospital, really have not changed since early on in the year 2020, so last year. And that continues to be remdesivir, steroids if you meet the criteria, blood thinners. There are a couple other immune modulators that we use if you reach that really severe disease. If you're an outpatient, it continues to be monoclonal antibodies. If you're at high risk of hospitalization, we are learning more about the effect of the monoclonal antibodies and how much activity they have towards Omicron. But it also, otherwise, those are really the main treatment modalities. Now, we are hoping that there will be the oral pills that will be available soon. But really, since the advent of the monoclonal antibodies and those inpatient therapies of remdesivir, steroids, and blood thinners, the treatment modalities haven't changed. And that's why individually, for us physicians and nurses and respiratory therapists and everybody who's taking care of those COVID patients in the hospital, the treatments haven't really changed. And they haven't changed based on any of the variants. So we don't really always know is this Delta, is this Omicron, is this Alpha? It doesn't really matter because all the treatments are the same.
This question pops up daily, so let's just address it before we head out today. About Isaac's just curious. It's basketball season. What do we feel about these big arenas, indoors versus outdoors, packed spaces, not packed spaces? Has that conversation changed?
Yeah, I'm nervous. Yeah, I'll be honest. I'm a little nervous about indoor stuff without masks, and so I'm nervous. There's a lot of folks, I think, as we see more and more community spread right now, the Delta variant, and knowing that Omicron is coming our way, it makes me nervous, Hawkeye. So I'm not super happy about a lot of packed indoor events.
Yeah, I would agree. But remember, you as a spectator, an individual, you are always welcome to wear the mask. They should be highly encouraged in those areas as an individual. You can continue to do that. We know that just those people, especially if they're vaccinated, wearing masks do have a reduced chance of infection. So I think that is very important.
All right, let's get to our final thoughts. And Jonna, I want to start with you out there with your students. First of all, just thank you for sharing them with us. Thank you for giving them this assignment so that we could all learn from it and get their viewpoints. Always so insightful, and we appreciate it. Just what are your final thoughts, Jonna? What do you want us to know?
Well, first, just thank you for having us, and thank you so much for giving them an opportunity to tell their stories. And I just really want to let them know, remind them how proud we are as educators, the school district, parents, how proud we are of them, of the way they have come through this and continue to move forward, and their search for knowledge and facts, and how they're sharing that with their peers, and just how they've really, again, come through this stronger and continue to move forward. And we just appreciate them and appreciate all the work they put in, and we're just very proud of them.
And Dr. Stites, what is your message to these budding medical professions?
First of all, I'm proud of what you've said. I love your art, and I love your words and the message you've given us today. Thank you for that. And we welcome you into the medical profession and the health professions, and look forward to your being a part of that. Healthcare is a great career. I mean, I've dabbled in some other things. It's still my favorite thing to do is sit in the room with the patient and visit. And I will just say to you that it is one of the most rewarding things you can ever do, because you get to work in both science and humanity at the same time and help people through science. It's just the best. And so thank you for what you're doing, and thank you for enduring with us.
Dr. Hawkinson, your final thoughts today.
Yeah, I think it's so important listening to these young people and understanding just how much they are needed to be in school, because we need them coming up and adding to our knowledge and helping us. We know it's important for them, for their own health, emotional and physical health, to be in school. We know the way to protect people in schools and help keep kids in schools, and that is continuing to understand the high-risk situations, and that masking helps and distancing helps. Most important of all, though, is also vaccination and getting those young people vaccinated as well.
Dr. Stites, I'm going to tell everyone about tomorrow's special program. Do you have anything else for us today?
It's the holiday season. Now, I could break out into song.
Yes,
it's
you
the
could.
holiday season. And have read Chiefs playing tonight. Just to point out, the Chiefs are hurt right now by a little bit of a COVID thing going on in the team, and that could be a big thing for tonight. But we should all take note from that. COVID's everywhere, and even if you take all the right precautions, it can still get you. So if you get it all sick, or you know you've been exposed, make sure you get tested so you don't spread that to somebody else. We need to bring an end to this pandemic, Kansas City. We need to bend the curve. We can do it. We've done it before. Tune in tomorrow so you can learn more. But remember that the rules of infection control keep you safe every day up until this moment and every day forward, and they travel with you wherever you go. Make sure you take them, because they'll keep you safe.
All right, and we continue to remind you about blood supplies here in the metro. They are alarmingly low. We simply need blood. The community blood center's blood supplies stand at a 1 to 2 day inventory, well below the ideal 7-day supply. So you can check out your screen right there for a couple of ways that you can call or log on to schedule an appointment, and you can go in and give the gift of life. It's the best thing you can do this time of year. Okay, thank you all so much for being with us today. Don't forget you can catch our show anytime on Facebook and our YouTube channel. Coming up tomorrow, we will have a very special morning update as chief medical officers and infectious disease specialists join us to talk about the current COVID risk to help you better determine your safety. Just like yesterday's storm winds, they posed a threat. You could say it was a perfect storm. And it was brewing, and it's brewing now, making conditions favorable for COVID to quickly overwhelm the region's healthcare system. So tomorrow, these healthcare experts will share their inpatient count and be available to answer your questions and reporter questions. So please join us, spread the word, tune in, and we will see you then.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.